and do that chin fall. Good. Perfect. Good. All the way right. Hey everybody, it's Dr. Tiffany at Sioux Center Chiropractic, and we're located in Sioux Center, Iowa. And today I am adjusting Whitney for the very first time. She's pregnant, almost 32 weeks, with her third baby girl. And this will be her first adjustment while being pregnant. She's been adjusted before, but never while pregnant. So Whitney, tell us what you do, and then tell me a little bit about your pain.
So I'm a licensed cosmetologist. I do men's haircuts all day long. So on my feet all day, arms up all day, and yeah, my upper back is not okay. It's not right.
It's not right. So she's here. So we're gonna adjust her. I'm gonna assess her. I'm gonna move her through a functional screen. So I'm gonna see what's not moving like it should, or what's causing her pain or tightness while she's moving. And then that's gonna help me kind of build the case as what needs worked on with her. So she's pregnant, so obviously we're gonna adjust her pelvis because we want a third 3-for-3 vaginal births. That's her end goal, so that's my goal for her. And we wanna make sure that's a nice, easy birth, and everything's as lined up as it can be, so that that baby has as big of an outlet as it can coming out. And then I find this all the time with anybody who does hair, your guys' hands are just up all the time. But unfortunately, your upper body and your traps take the bearing weight of that, versus what it should be is coming from your core. Well, like you said, not on camera, was when she's pregnant, this pain comes back because the core, her pelvic floor, her diaphragm, all kind of gets turned down because there's a baby in there, right? So what we're gonna do after we get her adjusted, do some soft tissue work, we are gonna start working on the brain connection to her core and see if we can't build that back a little bit so she has a stable core to build from, or to, so she has a stable core to rely on, so her traps aren't doing everything. They're still doing a lot, but hopefully some of that burden gets taken off when we get your core turned back on. So let's get to work. Okay, you can stand right here, Whitney, and I'm just gonna have you mirror me. So her neurological exam, everything turned out good. Orthopedic exam, we're just strictly dealing with musculoskeletal, which is how we know she's in the right place. Okay, so go ahead and face me, and I'm gonna have you look all the way over one shoulder, Whitney. Good, any pain? No pulling or tightness? Good, okay, let's go the other way. Any pain? Nope, good. Okay, go ahead and face me. Put your chin all the way on your chest. Okay, any pain?
No pain.
Okay, come on up. Chin all the way up. Anything? No. Okay, go ahead and face me. Then you're gonna rotate your upper back and your neck all the way to one wall. Good. What do you feel?
That's where the tightness comes.
That's where the tightness. Yep. Why don't you? What's stopping you from going further? Where's the pain at? Right under that right bra strap area. Yep. Okay, go ahead and let's rotate the other way. Anything?
Not as tight.
Not as
same
tight.
Type of thing.
Still on the right, or did it move to the left?
It's like right in the middle.
Right in the middle. Okay. Yep. All right, go ahead and face me. Touch your toes nice and slow for me. I know there's a baby. If you need to open your legs up, you definitely can. Good. Come on up. So I don't know if you guys could see that from your vantage point. When she touched her toes, she definitely had a little bit of rotation already happening, even though she was going straight down in her middle back. So that just tells me a little bit about your day-to-day posture, and maybe even your sleeping posture. And then next thing you're gonna do is bring your arms up and follow them as far back as you're comfortable going with your eyeballs. Good, any pain with that? Awesome. All right, let's go ahead and let's sit at the end of this table right here, Whitney. We're gonna just motion palpate. So what that means is I'm just gonna feel all of her joints. So the joints just make up the space between bones that moves. So we're gonna take the joint through what should be a normal motion. So I'm starting at her SI joints, her lower SI joints. Good, I want you to kind of hunch forward for me. There you go. See? Noting in my brain what's not moving when I'm pushing on it that should be moving. You feel all that?
Yep.
Yeah, that should be moving.
It's better.
Good, we're going to rotate a little bit here. Any pain when I'm pushing? Good. All right. Whitney, go ahead and interlock your fingers and put them behind your neck like this. Perfect. And you're just going to translate your weight just right into my arms. Good. Come on. You can drop those down. I'm going to feel what's going on up here. A lot of tone up here. Take a deep breath for me. Good. So I don't know if you guys could see that, but when she took a deep breath, it was all right here versus in her core. Well, she's got a baby down there, but we still need to get some of that breathing down to your tummy, because every breath you take, you're using these accessory breathing muscles as primary breathing muscles versus your diaphragm and your built-in breathers. Okay. So I'm just palpating her collarbone up here. So you still work out? A little bit here and there.
Mostly just walking.
Mostly just walking, good. Any pain when you're walking?
The upper back. After a while, yeah.
So I'm doing the same thing. I'm just moving these cervical joints through their normal ranges, and I'm just noting, and you can kind of note that too, right? Where it's not moving like it should. Good. All right. Okay. You ready for this?
Ready.
Any questions? Any nervousness for your first adjustment?
No, I'm excited.
All right. I'm here. I'm not sensitive. I trust your intuition. So everything I'm doing is totally safe, but let me know if you're not comfortable with anything. So my table pops down for the belly, and then I add some additional pillows. So go ahead and let's put your belly in the pillows, nose on the paper, Whitney. All right. Good. So if you can kind of see straight down her body here, there's definitely more tone, a little more rigidity on this right side. Are you right-handed?
I'm left-handed.
You're left-handed. So you're doing something with this right side, probably leaning on it or using it a little differently than the left. And this is about where your pain's at?
Yep.
Awesome. Okay. Well, not awesome, but then the other thing I'm just looking at is just the height of her hips. And I can see she's a little bit higher on this left side. So that's just creating, she's high here and high here. She just has almost a corkscrew effect, which is a survival technique of your body, right? Because what do we want? We want our eyes level with the horizon. So our ancestors could see threats, they could see food. So it's never going to let us not be centered. So if one area of your body starts to rotate, there's going to be a kind of opposite correction with that usually. Good. So with pregnant women, I use what's called this drop table. It allows me to set the tension, but unlike when you're not pregnant, I don't like to do side posture. I like to keep the pelvis and therefore the uterus stacked. I never want to add torsion or twisting into the uterine muscles, because the goal is as much room for a baby and as much symmetry as we can handle. Good. Any pain with that? Good. So when you were, I know you've never been adjusted pregnant, but when you were adjusted in the past, Whitney, did you get really sore after? What do you remember about that?
Not too bad.
Okay, awesome.
I'm going to just drink a lot of water.
Good. Okay, so drink a lot of water. You can, at this point in your pregnancy, you're 32 weeks, you can do a cold pack, bra strap and up, but I really don't want a cold pack below. I don't want to do anything that's going to cause that baby to flip from its head down position where you're at right now. And we're just going to really try and see as minimal as we can get away with as possible, because as you know, your body is just so different when it's pregnant. day to day even, right? Hormonally, every cell in your body just changes. Good, breathe in. Breathe out. Good, and I'm just going through and I'm just making sure everything's moving like it should. And if it's not, I'm adding a directional force through the joint. You okay with that? Okay. Okay, good, awesome. Come on up. All right, so one thing Whitney did tell me was she doesn't love having her neck, like the cracks that come along with a cervical adjustment. So this is the first time she's ever been adjusted by me. So we're gonna try it and she's just gonna really openly communicate. If she hates it, no big deal. If she's cool with it, awesome. All right, let's go on your back and let's check out that neck a little further. Yes, please. You can have your knees up. You can have whatever's most comfortable on your back. Oh my goodness. So anatomically, we have 12 ribs. Most of our ribs come around and under our armpits. We actually have 2 ribs that come up. Do you feel that? Mm-hmm. Yep, and it's not over here. So she's got 1 rib on the left side that's popped way up, and I wonder if some of that's causing your arm pain. Like, oh man, it's tight. Okay, so we're just gonna go nice and gentle, okay? Mm-hmm. And I'm just gonna kind of move her through the range of motion we're trying to correct so we can put the most force, directional force, into where we want it to go. How'd that feel?
Not bad.
Not bad, good. Good. Any headaches? Mm-mm. Good. Good, same thing. Just let that chin fall. Really good. Okay, in this position, we're just gonna do a little bit of soft tissue work, okay? Mm-hmm. I'm going for a good hurt. Okay? Like a hurt so good, not like a hurt. So tell me if we get past a hurt so good. I don't want to hurt you and I don't want to bruise you. So what I am doing is I have my thumb on this.
Yeah, that's like a hurt so
good. It hurts so good. Okay, good. Oh, man. And I'm just trying to move her through a little bit of cross friction so we can break up a little bit of the adhesion she's built up. And adhesions are a good thing. They're protective, right? It's your body's way of saying, okay, this shoulder over here is always up. Let's give it a little bit of stability. Well, I'm going to break it down, and then we're going to teach her how to breathe and stabilize a little bit better in her core and pelvic floor. So hopefully her body doesn't have to tighten her right back up, and she can we can keep building on this versus just stretching it. Your body tightens it back up to protect you, stretching it, and your body just keeps tightening back up. You okay? Mm-hmm. You doing okay? Not too hot? Good. All right. Come on up. All right, I'm going to have you throw your legs around and we're going to face that way. Good. Oh, it feels better. Still a little tight there, though. I'm going to let you move me. You're going to let me move you. Words are hard when someone's filming you. Good. Tuck this chin forward a little. There you go. Now we're going to go extend back. You okay? Mm-hmm. Elaine's on you. Woo! Good. Okay. All right. Go ahead and stand up. You can stand in front of the door. I'm just going to have you move through those ranges of motion again, okay? So we're just going to rotate right and left. How's that feel?
Better.
Yeah? What percent better?
Like, it doesn't hurt.
Yay! Let's go the other way.
I feel like I can breathe when I do that.
Awesome. Good. Still a little bit there.
If there's any, it's this way.
That way to the left. More on the right side still. Just okay, so let's just do a little bit more muscle work right on that left, those paraspinal muscles right in here. Okay, go ahead and give yourself a hug. Good. So I'm going to have you rotate all the way left as far as you can with your elbow. There you go. Now you're going to rotate all the way right. Good. And if you can, try and tuck your chin and round your upper back down, like someone kind of punched you in the stomach. Good. Does it hurt so good? Not a hurt?
Yep.
Okay, good. Let's go left. Let's do that again. Good. Rotate all the way right. Good. All the way. And tuck, tuck. Good. Perfect. Good. All the way right. You okay? Mm-hmm. Good. All the way right. Okay, so I'm trying to think. So is there anything you do? Like, do you lean on the right side of like your car console, or do you have a spot on the couch that you lean on a lot on the right?
On my right side.
You lay on your right side. Okay. So I don't want to mess with your sleep. So just try and figure out like when you're sitting, if because it looks way better. This, so all these ribs you had here that attach into your spine, everything was just not moving like it should and kind of creating that almost hunched distortion over here. So I just want you to be really super conscious of that during pregnancy, right? Because there's never another time in your life where you gain only weight in your uterus, right? Like 20 pounds right here, right? So, and that's just going to change all of, you know, your center of gravity. So just be super, super conscious. But I still think the best bang for our buck is going to be to really work on getting your core and your brain reconnected so that you have a better center while you're working to pull from. That feels better. Okay, let's lay on your back. And what we're going to do is work on breathing.
Okay.
Your job is to tell me if you need a break. Like if you want to get up, walk around, you feel lightheaded, you feel like you can't catch a good breath.
Oh boy.
You do have a baby in your belly, so you get some special treatment here. So did you ever do singing?
Yep.
Like belly breathing?
Yep.
Okay, so we're going to try and reconnect that. So your core has a top and a bottom. The top of your core is your diaphragm. Do you know what a diaphragm is? Can you imagine that? It's like this muscle that kind of tucks right under your ribs. And then as you breathe in and your lungs get big with air, that lowers down. Okay? So it's your built-in breathing muscle. It just makes room for air and then it comes up to push the air out. The bottom of your core is your pelvic floor. So can you imagine what your pelvic floor looks like?
Yep.
Most people think it's kind of like elusive. So if you think about like your pelvis, this bony circle we have right here, there's like a sling that fills the bottom of it. It's connected through the front, the bottom, and the back of your pelvis. So that has sphincters in it for bowels, for urine. It holds all of your organs in your body. Okay. So when the top and the bottom get contracted, they move down together, right? So super important when it comes to pushing out a baby, because that diaphragm pushing your baby down is a huge, it's just going to make every push during labor really productive. But it's also going to give you just something, a little bit of more of a base of support while you're standing and working, doing hair all day. Okay, so we're going to reconnect that. So I love it when people are singers because belly breathing, right? You already know how to do this. So we're going to start with one hand on your chest and one hand a little further down here on your pelvic floor. Good. And you can come even a little closer right down there. Good. What I want you to do is I just want you to take a deep breath and try and only move this hand. So hard. There's a whole human in her body. Very good. Let it go. Good. Do it again. Good. In through the nose, out through the nose. It's a heavy baby you're moving. Really, really well. Amazing. Breathe in. You can feel that shaking. Your brain's trying to take over. Breathe in. Okay, while you're doing that, I also want you to try and, I'm pushing in your back right now. And what I'm doing is I'm trying to give your brain something to push against. I'm trying to give your brain some reference point to find, because as far as like muscle contraction, you can say flex my bicep. That's really easy for your brain to do. But when you're trying to expand and activate all the muscles that make up the outside of your core, or you can say the outside of this can, right? We've got a top, bottom, and a circle. It's really hard for your brain to find it on its own. So I'm just giving it some feedback. So now, not only do I want your hand moving here, I want you to push me out 360 degrees with your air. Breathe in. Really good. You need a break? You feel like you're going to pass out?
No.
Okay, just let me know. Breathe in. Amazing. You feel that in your back? You're doing really, really good. Breathe in. Awesome. Okay, so it's so good. You're doing so good. So you're breathing with you're breathing down into your core right now. Okay, so it's way easier to hold a brace or have some pressure in your tummy and your core when there's air in it. Okay, so air can come in and out. It's just easier when there's air in there to fill it, especially as we're training it and especially as there's a person in you. Okay, so I definitely don't want you to hold your breath as we're going through these exercises, but a lot of people kind of choose to hold a little more air in their tummy to keep the pressure in the core activated as we're adding weight into the system. Does that make sense? Okay, so you don't have to hold your breath, but a lot of people, it just seems to be a little natural first step. Okay, so what you're going to do is you're going to take a deep breath. And the only rule I have here, good, let it out, is when we add weight into the system, you can't feel it in your back. Okay, I don't want you to feel your back muscles turning on. I want you to feel the middle of your stomach here, your pelvic floor, which is down here. I want you to feel that activating and not your back. Okay, so you're going to take a deep breath, and when you have as much pressure as you can, you're going to, on your own, bring this leg up to this 90-90 position.
Okay.
All right? All right, give it a try. Breathe. When you have a nice activated core. Okay. So sometimes the more air, the easier it is to keep that core turned on at the beginning. So take a deep breath and keep, good, bring that leg up. Really good. Where do you feel that? What worked to get this leg up?
I don't know.
Did you feel it in your back?
No.
Okay, good. All right, let's do the other side. So same thing, just make sure there's a good amount of pressure in this belly so that your back doesn't take over.
Okay.
I want this on and this off. So take a good breath, have some air in that tummy, and bring the other side up. Awesome. Where'd you feel that? What did the work?
I don't know.
It was just weightless?
I think, yeah.
Yeah?
I think I can feel like,
it's
it's like my obliques.
Uh-huh.
Yeah.
I was going to say, I see your abdominals going. Okay, so as long as you didn't say your back, right answer. Okay. All right,
Yeah,
so.
I feel it back there.
Awesome.
I feel like, yeah.
Good. This sling right here. Awesome. So what you're going to do is you're going to take a couple breaths. So this is kind of your neutral position as you're starting some of these core exercises. So the closer your knees are to your baby, the lighter your legs get. Okay, so if you can bend a little, you can even open. See how much lighter your legs get. Okay, so you can start by just breathing legs flat. And you're like, okay, I've got my brain turned on. I'm breathing in my belly. I'm breathing in through my nose, into my stomach, not the opposite way around. And then when you feel like you've got enough awareness of what you're doing, have pressure in your belly, and then start to raise each leg. And now what you're going to do is you can just lay here and breathe, okay? So this is a pretty safe position to let things in and out. Good. Breathe down here. Awesome. All right, next time, take a deep breath. Now what you're going to do is you're just going to rotate this hip down, drop your heel, don't transfer your weight, and bring it back up. Good. Yeah. So the only rule is what? You can't feel it in your back. Okay, take a deep breath. Okay, drop a heel. Just tap nice and slow. Good. Good. Awesome. So, where'd you feel it?
All of this.
Good, 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 good. Okay, right
It's
answer.
starting to get like.
Good. So the closer to your butt
Feels
and
like
the
a
and the
workout.
faster the tap, the easier it is, right?
Okay.
Because there's just less, the further you get away from this heel gets away from your body, the heavier your leg gets, okay? So we're just adding a very minimal amount of weight. So just so your brain can coordinate adding a little bit of work and weight into your core. All right, let's try the other side. Nice, nice tone in your belly. Flat back, drop your heel. Weightless, awesome. Did it feel easy?
Yeah.
Good. Okay, so the goal is 10 by the time I see you next. All right, just 10. I don't want you holding your breath. Just pressure here. No, nothing in your back. But we're gonna try 4 on each side. Okay. And the name of the game is slow. Okay. So remember, this is safe. You can relax here. Get a good breath here. Okay. Okay. Breathe in. Good. Drop a heel. Wonderful. I feel it. You're feeling shaken. Let's do 3. Let's just do one more on each side. Drop this side. Great. I see you. I see you working. You got a whole person in you too. Breathe in. Amazing. So don't let that go before you're safe. Okay? It's just like a squat. Here, let's finish and then we'll talk. Drop that one. Amazing. Other side. Drop that one. Good. Amazing. Okay, let's bring these down. Let's sit you up and breathe. There you go.
Like,
awesome.
I'm starting to sweat. This is
I know you are. I know you are. So it's frustrating because it's a lot of brain work because we're just learning how to re-coordinate your core. Okay, your pelvic floor, your diaphragm, all the muscles. So your goal is 10 on each side. Slow down. Before you start doing your exercises, think about what you're doing. And I always tell myself, because we all, like, even though you have a baby, you're still going to tend to, like, try and suck in, right? And it kind of just turns everything off. So lay down and just think to yourself, what am I trying to do? When I breathe in, I'm filling up my balloon, right? When I breathe out, my balloon gets smaller. So think of your tummy kind of as a balloon. And just start with 10 minutes a day. It can just be, oh my gosh, I got hit by a train today at work. I'm just going to lay here and belly breathe. That counts. Or I'm going to see if I can add a little bit more work into the system. Breathe for a few minutes. Bring my legs up with a nice sturdy core, no back activation, and do a couple heel drops, right? And then you can say, oh, I'm shot. I got 4 out of each side. Breathe a little bit, okay? You can do that with your heels on the couch, back flat. You can just lay in bed and just belly breathe and just remind your brain the normal anatomical motion and where you're supposed to be breathing down here versus up here. So let's do 10 of those, and then I get to see you hopefully next week. Awesome. Okay. Yeah. Yay. Thank you.
Thank you.
Thanks, everybody.